True started about 10 years ago, and it initially started with six people. So it started as a small project, and from there it has grown basically into a research center where we carry out a number of clinical trials. We do a number of research where we target health-based interventions for the population in order to try and improve the health of a population. TRUE stands for the Training and Research Unit of Excellence, and it's basically a research organization. We are into the business of trying to find innovative health solutions for problems that the country is facing at the moment. And as we speak, we're also thinking about how do we bring and design new health solutions to prevent and to treat these new emerging diseases. We have an establishment of about 100 people, and we are in different sites, mainly in southern Malawi, where we are conducting research based at the hospitals or health facilities within the country, working closely with the Ministry of Health. But we also work in the communities where there are also special problems that are community-based. About 10 years ago, we started to trial or to test an intervention, a health intervention, where we tried to manage kids who had severe anemia. So what we had observed at the time was that kids who have severe anemia, when they come to hospital, they're treated, but still when they went home, when they're discharged, they still got very sick. We saw them back in hospital with another severe anemic event, and some of them even died. And since then, we've been studying this problem, and we came up with innovative solutions. We figured out that one of the problems that they were facing was that they were at risk of malaria, and a lot of them tended to suffer from malaria because of their rather lower immune status when they're discharged. And we designed an intervention where we gave them malaria and anti-malarial. So things that we commonly use at the moment are things like Coartem, some people call it La, and basically giving them intermittently every month for that initial time when they have just been discharged from hospital. And we carried out a huge study across Malawi, Kenya, and even Uganda, where we have shown that if you do give this intervention to these kids, you can decrease their rates of coming back to hospital or even death by 30%. But death alone, we can reduce that to close to 90%. So this is a huge, huge impact of a single health intervention on mortality, on death. And I recently presented these findings to the World Health Organization in Geneva, where they were very excited, and they're now hoping that it will become policy across all countries in the world where malaria is endemic. One of the reasons of setting up TRUE was for us to grow local and regional talent. So we have a very strong capacity strengthening program where we train mainly PhD students and postdocs from within Malawi. We presently have even postdocs from outside Malawi. And what I see in the future is this center of excellence that's regional, where we are carrying out research that is directly relevant and answering the problems that we're seeing within the region. And we have grown talent that is actually addressing those problems. So we're slowly, strategically trying to build up that critical mass of researchers. We are also trying to grow our infrastructure. So what we would call the research platform where we conduct our research. We have plans to build a research center in Zomba. We are already have satellite field stations in about 6 districts in Malawi. We're hoping that that would also grow so that we can support all these big ideas that we have. We're also looking at growing our collaborations. We work with various people within Malawi and also outside. Recently, we have been in touch with USAID. We already work with WHO. We have worked with the World Bank and obviously the Ministry of Health. And we want to also see that network of collaborations also growing. We really are a young center that we believe where we want to grow people who think outside the box for solutions to address our present and emerging health needs.